Welcome viewers, this is your anchor Kekrizanya Solo. You're now watching HornbillTV. A virus first discovered in India more than 6 decades ago is once again raising serious public health concerns. The Chandipura virus, which is a rare but potentially deadly infection that primarily affects children, and it has resurfaced in Gujarat again, claiming several young lives and triggering renewed health concerns. Known for its rapid progression, the virus can turn a simple fever into severe brain inflammation within just 24 to 48 hours. And with no specific treatment or vaccine available, early detection is crucial. So what is the Chandipura virus? How does it spread? Who is most at risk? And why does it keep returning? Here's an explainer. The science behind the disease and why health authorities remain on high alert. Starting with what is Chandipura virus. The virus derives its name from Chandipura village in Maharashtra, where it was first identified. It was isolated in 1965 by scientists from the National Institute of Virology, Pune, after 2 patients developed a dengue-like febrile illness. Initially, researchers believed it caused only a mild fever. However, subsequent outbreaks revealed a far more alarming picture: its ability to attack the brain and claim young lives within hours. Knowing its origin is only part of the story though. The next question is, how does it infect people? Unlike COVID-19 or influenza, Chandipura virus does not spread from person to person. Instead, it is transmitted through the bite of an infected insect, primarily female sandflies, which is a primary vector, possibly mosquitoes too, and certain biting flies. Cases usually increase during the monsoon and post-monsoon months when vector populations multiply. While anyone can be infected, the virus overwhelmingly targets one age group. Children are the most vulnerable because their immune system are still developing. They spend more time outdoors where vectors are active, and the virus progresses much faster in younger patients. Most reported deaths have occurred among children younger than 15 years. The biggest challenge, however, is that the disease often begins with symptoms that resemble a common viral fever. The illness initially looks like many other viral infections, making early diagnosis particularly difficult. Early symptoms include sudden high fever, headache, vomiting, weakness, body pain. Severe symptoms include convulsions, fits, altered consciousness, drowsiness, coma, brain swelling, which is also called encephalitis. And one of the biggest concerns is that neurological complications can also develop within 24 to 48 hours, leaving doctors with a very narrow window to intervene. Now, this raises another important question. Is there any specific cure for Chandipura virus? Well, unfortunately, the answer is no. Currently, there is no specific antiviral medicine. No approved vaccine treatment is therefore supportive and includes intensive care unit (ICU) care, ventilator support if required, anti-seizure medication, intravenous fluids, management brain swelling. Early hospitalization also remains the best chance of improving survival. Although the virus is uncommon, India has witnessed several significant outbreaks over the past few decades. Starting from 1965, where the virus first discovered in Chandipura village in Maharashtra, as mentioned before. Initially linked to a mild febrile illness, in 1980, virus isolated from a patient with acute encephalitis in Madhya Pradesh, strengthening evidence of its neurological impact. Coming to 2003, one of the deadliest outbreaks occurred. Andhra Pradesh and Maharashtra reported 329 cases and 182 deaths, mostly among children. And then 2004, where Gujarat recorded sporadic outbreaks among children. 2009, in Maharashtra reported 52 confirmed cases and 15 deaths. Moving on to 2010, where Gujarat experienced another outbreak with 50 confirmed cases and 16 deaths. From 2014 to 2019, sporadic cases continue to be reported from Gujarat and neighboring states. Fast forward to 2024, India witnessed its largest Chandipura outbreak in nearly 2 decades. Gujarat reported widespread acute encephalitis syndrome cases. With the virus confirmed in dozens of children, authorities recorded at least 56 encephalitis-related deaths, with Chandipura accounting for a significant share of confirmed infections. And now coming to the current outbreak in 2026, where Gujarat has reported 184 suspected cases, 35 lab-confirmed Chandipura infections, 22 child deaths have been reported, while investigations continue in additional suspected cases. Well, the Union Health Ministry has also deployed a national joint outbreak response team to strengthen surveillance, diagnostics and vector control measures too. But one striking feature across almost every outbreak is the virus's unusually high fatality rate. But then, why is it so deadly? Experts point to several reasons for this, which is extremely rapid disease progression, delay in recognizing symptoms, lack of specific antiviral drug, severe inflammation of the brain, children reaching hospitals too late because the disease can worsen dramatically within hours, and also early medical attention is often the deciding factor between life and death. Prompt diagnosis is therefore crucial, but confirming the infection is not always straightforward. Therefore, doctors rely on blood samples, cerebrospinal fluid, which is also called CSF testing, RT or PCR lab testing, National Institute of Virology and IV confirmation. In many cases, diagnosis is often made alongside investigations for other causes of acute encephalitis syndrome. Since there is no vaccine or targeted treatment, prevention becomes the strongest defense. There is no vaccine, so prevention focuses on avoiding insect bites and controlling vector breeding. Use insect repellents, sleep under insecticide-treated bat nets, install window screens where possible, dress children in full-sleeved clothing, especially during evenings, and keep homes and surroundings clean. Sometimes fill cracks in mud walls where sandflies may breed, and also eliminating stagnant water and maintaining sanitation. Also seek immediate medical care if a child develops sudden fever with vomiting or even altered consciousness. The Union Health Ministry has deployed a National Joint Outbreak Response Team NJORT to Gujarat and Rajasthan to strengthen surveillance, diagnostics and vector control measures. Despite repeated outbreaks and improved surveillance, the virus continues to reappear almost every few years. So another question rises, why has it not disappeared after all these years? The answer is that Chandipura virus remains endemic in parts of central and western India, with monsoon conditions creating an ideal environment for the insect vectors that spread it. And in the absence of vaccine or say specific treatments, experts say early detection, prompt medical care, vector control and public awareness remains the best defense against future outbreaks. As of early August 2026, Gujarat has reported 22 child deaths linked to the Chandipura virus outbreak, with 35 lab-confirmed infections among 184 suspected cases. For a virus discovered more than 60 years ago, Chandipura continues to pose a serious threat to children whenever conditions favor its spreads. Until science delivers a vaccine or targeted treatment, vigilance, early diagnosis and timely medical care remains the strongest defense. In the fight against Chandipura, awareness, it is not just important, it can save lives. So stay safe and stay updated. Thank you for watching Hornbill TV.